Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. When you call my office, you will be greeted by my office manager, my receptionist, surgical coordinator. They all get involved with patients right from the beginning. We determine what your treatment background has been. We obtain medical records. We want to know if there's been any other treatments. We try to get as much of the medical history that's occurred to this point as possible. Sometimes we're the first stop on the way to treatment. So there is no past medical history, and it's just you're presenting to us for the first time. Once we determine what is needed, an appropriate appointment is made, typically with myself in one of my offices. During that initial evaluation, obviously we start off with a conversation, what you're feeling. It'll be a more in-depth conversation than you probably typically are used to having, maybe with your family doctor. Spine surgeons, we need to do a more kind of in-depth analysis of the exact symptoms, when you're feeling, if you're feeling pain, when are you feeling the pain, what brings it on, is there anything else associated with it? We'll go into a more detailed history about anything that's occurred in the past. Obviously, there are many red flags that we always look for in our field. Spine problems can come from not only accidents or traumas or falls or car accidents or things like that, but it can come certainly from tumors and cancers and osteoporotic or other endocrine diseases. So we really have to look for a wide variety of sources for any kind of spine problems. It's not just limited to the spine problem. We can't afford to miss another problem. And unfortunately, I have been the first stop along the way and diagnosed people who've had lung cancers or other sources of problems that have come to the spine. So for those reasons, we really need to do a very in-depth discussion and history for every evaluation. Then of course there's an examination. We do our typical spine and neurological physical exam, looking for any neurologic damage, weakness, numbness, tingling, limited range of motion, tenderness, and so forth. And then finally, we would do an evaluation of any radiological studies. Now, sometimes patients come and they've already had x-rays and MRIs, and that's very helpful because then we can actually look at those studies during the actual examination. We do read the reports. However, as a spine surgeon, I need to see the actual studies. I need to see the actual pictures, not just the reports of any MRIs or CAT scans or x-rays. It's really vital to our purposes, and it's really part of the total evaluation. If there haven't been any studies, based on the evaluation that I do, I will determine whether we need to get MRIs or x-rays or CAT scans at that time. It is typical to get imaging studies, however, and typically the second visit or follow-up visit will include a review of those studies. We will go through those studies together. I don't look at them by myself. I will look at them right there with you. And if there's a problem, I'll show it to you, and we'll discuss why this is causing a problem, or even why I don't think that what I see on the MRI is causing your problem, because it does go both ways. And then based on a combination of your history, your symptoms, and what the MRI looks like, we'll determine what the best course of action will be. That may be completely non-interventional, physical therapy, medications, exercises, stretches. We get involved in every aspect of that care as well. It could mean injection treatments. We work with several pain management doctors. I perform some interventional procedures myself for some patients. And finally, if we determine that the problem is of such a degree, such severity that we will have to really turn to a surgical procedure. Then we would go over what that surgical procedure would be. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.